Oral cancer often begins with subtle changes. If you notice persistent white or red patches, ulcers that don't heal within 2 weeks, or unusual lumps in your mouth during daily brushing, these could be early warning signs. Studies show 75% of oral cancers are linked to tobacco and alcohol use. Early detection increases survival rates to 80 to 90%. Always examine your mouth under bright light after brushing. Many dismiss oral lesions as minor issues. However, research indicates that 50% of patients delay seeking help for 3+ months. Persistent sores that bleed easily or thickened oral tissues warrant immediate attention. The 2-week rule: any abnormality lasting beyond this period requires professional evaluation. Tobacco users are 10 times more likely to develop oral cancer than non-users. When symptoms persist, 68% of people turn to internet searches before consulting doctors. Searching oral cancer symptoms reveals terrifying possibilities: difficulty swallowing, loose teeth, or ear pain. However, only biopsies provide definitive diagnoses. The American Cancer Society reports 54,000 new oral cancer cases annually. Remember, early-stage cancers often cause no pain initially. Dentists detect 84% of oral cancers during routine exams. They use special lights and dyes to identify abnormal tissues. A Velscope exam can reveal hidden lesions by causing healthy tissues to fluoresce green while suspicious areas appear dark. The entire oral cavity examination takes under 10 minutes, but can be life-saving. Always request oral cancer screening during dental checkups. A positive biopsy result shows squamous cell carcinoma in 90% of oral cancers. Pathologists grade tumors from 1, slow-growing, to 3, aggressive. The TNM staging system evaluates tumor size, T, lymph node involvement, N, and metastasis, N. Stage 1 cancers smaller than 2 centimeters had 85% 5-year survival rates. Treatment plans depend on these precise classifications. Treatment combines surgery, radiation, and sometimes immunotherapy. Robotic surgery allows precise tumor removal with minimal damage. Intensity-modulated radiation therapy, IMRT, targets cancer cells while sparing healthy tissues. New immunotherapies like pembrolizumab show promise for advanced cases. The MD Anderson Cancer Center reports 60% fewer side effects with proton therapy versus traditional radiation. Post-diagnosis, eliminating risk factors is crucial. Quitting smoking reduces recurrence risk by 50% within 5 years. Alcohol abstinence is equally important, as ethanol metabolizes into carcinogenic acetaldehyde. Anti-inflammatory diets rich in cruciferous vegetables and berries help recovery. Studies show 30 minutes of daily exercise improves treatment outcomes by 20% through enhanced immune function. Post-surgery rehabilitation often requires speech and swallowing therapy. About 40% of patients need temporary feeding tubes. Pain management combines medications with cold laser therapy. Salivary glands may be damaged, causing chronic dry mouth. New moisture-retaining oral gels and pilocarpine medications can stimulate saliva production. Support groups significantly improve psychological recovery rates. Patients with strong support networks have 25% better treatment adherence. Family involvement in medication management reduces errors by 60%. Cancer support groups decrease depression rates by 40%. Many hospitals now offer integrative care, including nutritionists and mental health professionals. Recording treatment side effects via apps helps doctors personalize care plans more effectively. 5-year survivors become powerful advocates. Oral cancer foundations promote monthly self-exams using the lips, cheeks, gums, tongue checklist. New saliva tests can detect cancer DNA with 85% accuracy. The HPV vaccine prevents virus-related oropharyngeal cancers. Remember, early detection saves lives. Share your story. It might prompt someone to get screened in time.